Hi, I'm Dr. Beatriz Molina from Medicas Clinics. Today we're going to showcase a full face approach on a male patient. We got here with us Steve, who is 50 years old. He has not had any treatments for about 7 years, so it's been a long time. He tells me he's put a little bit of weight on as well in the last few years. So he is trying to go back and lose some weight, but we thought we'd start shaping his face and contour and make it a little bit more masculine at the same time that we're getting his weight loss. So when we look at Steve's face, we focus on thirds. His upper third is actually not very bad at all considering his age. He does have obviously quite heavy eyelids, and that's from birth, it's hereditary. He doesn't want to have an upper blepharoplasty, so this is something that maybe with a little bit of filler in this area you can sometimes improve, but usually I think some of the treatments on the upper eyelids for contraction of the eyelids with maybe something plasma technology would be better. Then looking at his eye area, he has got some eye bags, which again, that's probably from not sleeping very much and being a little bit tired. So we could try to improve that as well using some fillers. But the main area I think of concern would be the flattening of his cheekbone. When we sit in here, I do believe that by increasing his cheekbone without making it feminine, just more masculine, we can enhance this area and giving a little bit of a lift, which it will improve his eye, but also making a little bit more masculine in this area. So we got two choices for entry point. We can either come in an entry point in the malar area here and place the product in retrograde, linear retrograde. Occasionally it's also good to use a point in here because we can then work a little bit of the base of the tear trough and the cheeks, and then from there of course you can also go into the cheekbones. Occasionally it's good to use what we call a sandwich technique, so you will be doing the two entry points to enhance this area gently. There is not much thickness of the skin, so we need to be careful with the type of filler we use to volumize this area so it's not too noticeable. Moving then to his lower third, I would say that that's probably the worst because he's got a very flattening of the upper lip area. His lower lip is very good, but then his chin is quite flat as well. So my feeling will be that if we treat his obviously chin to produce an enhancement, ideally a projection on the upper lip will help as well for the look, and the most important one is probably his projection on the jawline. He's lost some bone here, and because of the excess heaviness of the skin there, he is lost a little bit of the contour. So I think with these two, we'll get a more masculine look. So cheekbone and jawline, but for the side profile, obviously chin is a must, also will help the projection of the jawline. But of course, if we could work on this area and project it a little bit, it will also help that. So the first injection point is going to go, as we said here, if we feel the malar bone, a small amount of lidocaine, 2%, aspirate, and that will work as a good entry point for our cannula. And then if we find his jaw here and the angle of the jaw, then we can put another injection in this area as well to numb it. Perfect. So we could do next is we use a needle which is a 23G, and with this needle we will use it as an entry point for our cannula. So what we want is just the tip of the needle. You can see where the hole is. Just the tip. We make sure the patient is comfortable. Some people like to roll a little bit to make the hole slightly bigger, but I'm not too worried because my cannula is a 25G, so I can use the hole very easily. So today we're going to use Aliaxin SV with a 25G cannula. So first we're going to prime the cannula. We can see the entry point is very much at the end. And then we can use the syringe as is a dart Find the small hole. Once you find the hole, you wriggle, pinching the skin, wriggle it in, because we want to go all the way deep into the bone. Now I'm on the bone, and then we're going to tilt it to go parallel into this direction to place the product parallel to the zygomatic bone. So we hold it, and I'm wriggling in with my fingers really gently, where you can either advance the skin on it at the same time, really gently. Patient is comfortable, so that means we can then stop, reposition our hand for injecting, then fill with your finger with the tip of the cannula. Now I can't, because I'm in the right level, so I'm very deep on the bone, but when I start the extrusion force of the product, I can feel a little bit of an elevation of the tissue. So very slowly we retrograde, watching the skin, and you're aiming to use about 0.2 every time you do in a straight line. Then we're going to just suddenly change a little bit of the angle. So now we're going in this direction, do the same process all over again. And again, another more or less 0.2. And then we could do the same by changing another angle, slightly lower. We want to use the whole mill and then reassess. So just I'm feathering the product all along the cheekbone area, and now I want to focus on the apex a little bit to put a little bit extra there. In men we have to be more careful than obviously on females. You want a really good OG curve, but on men it has to be a little bit flatter. There we are. When we finish injecting, you come up to entry point, bring your cannula back, release, and pressure. So this was our first injection point. So let's have a look at the results. If we get you to sit a little bit forward. We can see already an improvement on the definition here in comparison to the other side. But what is very interesting is how much better the eye area already looks without even working closely into the medial part of the tear trough, which we will do later. So next now, let's have a look again. Let's do the jawline next. So as you remember, we put in a small amount of lidocaine here before on the angle of the mandible. So I'm going to use my 23 needle again. Just another little injection point again. Leave it there for a second. We pull it out, and then we get our cannula with, again, we're going to use EV. The reason I'm using EV is because it's the product which has got the maximum lifting capacity within the range at the moment, and obviously it's very good for contouring and projection, particularly on a male skin. When the skin is a little bit thicker, you need a little bit more structure and support. So priming, this time the only difference is it's still a 25G cannula, but is a little bit longer. So this one is 2 inches long, or 50 millimeters instead of 38 millimeters. And we do the same thing. We use it as a dart. We find the small hole. Once we find the hole, we wriggle it in. And this time we want to stay subdermal. We don't want to go so deep anymore, unless you want to put a bolus on the mandible of the jaw, which in this case I do want to do. So first of all, I'm going to go in, find the bone, which is there. Finding the patient is comfortable, we reposition my hand, and I'm going to put about 0.2 bolus, really slowly. Perfect. Then I'm going to come back, and this time we want to play the product just subdermally in this direction and this direction, as we showed on the drawings earlier. So let's go back in, change the angle this time. Once we're in, we're tilting it. We can see now the movement on the skin. So this time we want to again wriggle it in. But we are dermal. So it's not too superficial because remember this is a thick product. We can go a little bit less deep if you go obviously a thinner product like a GP, but in this instance we want to be careful. So we don't visualize the product. And just place retrograde another maybe 0.2 until you get to the mandible. Then we're going to reposition and change the angle to follow now the jawline along here. And again, parallel to the skin, we want to go subdermal and wriggling. Can you see how gentle I'm going? And again, you can see it's not on the bone this time. Just do a very small, maybe another 0.2, 0.3. And then we come back to entry point again, come out, stop the bleeding. And now let's have a look at the results of the jawline. So we get him just to lift the head a little bit. Perfect. So we can already see an improvement and a lifting here, so the jowls don't look so heavy anymore. And it matches quite well the part of the cheekbone. If we compare it to the other side. But I do feel that we need to do a little bit medially here, just to support the front of the eye and also help lifting a little bit of this area of the nasolabial fold, but also because this point is very good to then work and feather it here, so we can start helping projecting this frontal part. He doesn't want his lips doing, which is fair enough, but at least we can help supporting the lip area. Now let's have a look at the result. So we can appreciate we have done the jawline here with the cheekbone, and we get him looking at the other way over there to the left first. Then we can see that the undone side is already lifted a little bit of the weight there. If we look at the other side now, we can see a better definition on the jawline on the angle and a nicer contour and improvement on the eye area. I do feel we need extra product sitting here and maybe some extra support on the upper lip area. Okay, so for our next entry point, as we said, we're going to follow usually where the tear trough goes, and then on the base more or less of your tear trough, which is this point here, and you can check it with your finger because it's the maximum lifting point for that area, and usually you get also a lifting here. We are going to put in a small amount of lidocaine again as an entry point. So aspirate, always aspirate, a small amount of lido. That's it. And then with our 23G needle, we can do another insertion point next to the lidocaine. And perfect. Okay, and now for the tear trough, I'm going to change the product to GP, which is a little bit softer and it's a bit less bigger molecule size. And we're going to use it to place a little bit amount in the tear trough and in the middle of the cheek to support the front here. And then I will change the angle and come in this direction and just support this area in obviously upon the nasolabial and the top area of the lip, just for support. So let's do the same than before. We find in a small hole, and I'm going to first go deeper because we're going to do the tear trough. So I do the same than before, pinch the skin, go a little bit in. You should feel like a little pop, which I just done. That means I've gone deep enough. I'm going to do a little angulation, so I'm just touching now the bone there, and then I'm pinching the fat pad, and then rolling very gently my cannula underneath of the fat pad, following the tear trough. And when I'm trying to lift it, you can see I can't. That means I'm definitely in the right plane. I can put my finger to protect the product from traveling into the eye area. And then once I'm there, I'm relocating, considering the patient is comfortable, and then start a very small linear retrograde. Usually 0.2 to 0.3 of product will be placed. And every time I come to my entry point, I need to readjust. So I need to pinch again go in and then change direction, because this time I'm going to be on the frontal part here of the cheek. And again 0.2. That should be sufficient. Now I'm going to change totally angle, and I want to go in this area here. So I need to stay subdermal. So as soon as I get in, I'm changing the plane, as you can see, and then very gently advance, wriggling again my cannula towards the area I want to go and work. Perfect. Just here, and we're going to do the base of the nasolabial. So it's only placing product along the nasolabial fold to soften it a little bit. And this area here, the submalar part, where usually you lose volume and creates a weight here on the jowls. So if we put the product here, it will lift in there. Normally you notice that more on obviously individuals that are very thin. Usually they have a big amount of volume loss here, and they look very hollow and gunted. So I think that should be sufficient. So I'm coming to my entry point, coming out and stop. Okay, and now let's have a look at the results. So just to recapitulate, head a little bit up. We did first the cheekbone, then a little bit on the jawline, then we did a little bit of the tear trough, and this area here just to support. And as we can see, it looks really lovely. I may just remove this a second so you can actually see even better, because I think the drawings can be a little bit distracting. I only left them for a reference, and we can then have a look again. Turning. You will agree it looks quite natural. And of course, in about 6 weeks' time, we will revisit and put a little bit of further filler again on the jawline and on the cheekbone area here to keep the lift. And now we're going to move then to the part of the chin and the marionette area. So first of all, let's put in a small amount of lidocaine on this here and this point, because from here with the cannula, I can work in a fanning technique covering the marionette area and the base of the chin, and then I may have to finish the chin later with a little bit of a needle. So we go back to use the GP, and the reason I'm using GP is only because it hasn't got very deep marionette area. So I'm only want to support a little bit from this area on a fanning technique. So I want to use something soft, which is going to move with him, and it's not going to feel like he's done any treatments. So as we saw earlier, we've done the little entry point, obviously here with a lido, and then we could just find it now subdermally towards the chin line, which is a little bit more uncomfortable usually because it's quite a tight space. There we are, and then we can place the product retrograde and gently along there, very slowly retrograde, again 0.1, 0.2 per strand, and then fanning all along the chin. Go back to entry point, find my hole again, and stay in subdermal there. There we are. I'm staying away from the lip. And another one, so it's our third one now. Okay, placement of the product. And then just some on the corner of the mouth. And see again, my depth. So staying not too superficial. Occasionally, if you want to reinforce any part of this area, you can actually go across this area here, and sometimes you do require to put a small amount of product as well. And you can even reinforce this part of the jawline but being careful not to accentuate the jowls. So keep away from the jowls. Perfect. Coming back to entry point, and voila. And now we're going to proceed to do the chin enhancement. For that, as I said earlier, we can use obviously the cannula from here and fan a little bit, but also very easily is to use the needle. And for this, my product of choice will be SV, which is the new volumizer from Aliaxin range. So it comes with this type of needles in the pack. It's a little bit longer, which is great because you want to go on the bone. So first we're going to mark the area so I know exactly what is the middle of the chin, and then I'm going to pinch the skin and then place the needle above the mark, go all the way into the bone. That's the bone there. If it's comfortable, then I'm going to reposition my hand for injecting. Going to count to 5 or 10. Making sure there is it's very hard to aspirate with these products. They are very high G prime. So he's comfortable, I'm comfortable as well, then I'm on the bone. And then holding my chin up and down so the product doesn't disperse on those directions, I'm going to start placing the product very, very, very gently. So very, very gentle, very slowly. You can use obviously 1 to 2 mils depending on how much you need. Usually 1 mil gives you a very nice projection. And you have to go quite slowly because it's a little bit uncomfortable. When I'm confident that I have finished, I'm going to stop injecting, come out really slowly and apply a little bit of pressure. Let's have a look at the result from the chin treatment. So again, getting your head a little bit forward. And then we can just have a look at the right and the left. And we can appreciate the difference between this side of the face, which is treated, and the other side of the face, which has been untreated. And we will agree that it looks very natural. And then we can go and do the other half of the face next.